This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Zuviston 10 tablet is an effective hormonal therapy used to address progesterone deficiencies. It helps manage various female reproductive health issues. Indications and uses. This medication is utilized to relieve menstrual pain, manage endometriosis symptoms, and alleviate premenstrual syndrome. It also plays a crucial role in supporting female reproductive health and is used in postmenopausal women to mitigate menopausal symptoms. How it works. Zuviston 10 tablet works by supplementing the body with artificial progesterone, which helps correct hormonal imbalances and restores the uterine lining. Directions for use. Take Zuviston 10 tablet exactly as prescribed by your healthcare provider. It should be swallowed whole with a glass of water and can be taken with or without food. Try to take the tablet at the same time each day to maintain consistent hormone levels. Your doctor will determine the appropriate dosage based on individual health conditions. Possible side effects. Potential side effects may include severe headaches, nausea, breast pain, and irregular menstrual periods. Consult a healthcare provider if any side effects persist or worsen. Precautions and warnings. Caution is advised for individuals with liver issues, depression, or those who are pregnant or breastfeeding. It's crucial to inform your doctor of any existing health conditions before starting this medication. FAQs. 1. What is Zuviston 10 tablet used for? It is used for managing progesterone deficiency related issues. 2. How should I take it? Swallow the tablet with water and do not crush it. 3. What are the common side effects? Common side effects include headaches and nausea. 4. Can I stop taking it suddenly? No, always follow your doctor's advice regarding discontinuation. 5. Is it safe for children? It should only be used in postpubertal females under medical supervision. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is appreciated.